portions of material. If not, we have like a kind of a checklist that we're going to go through.
I was gonna say I'm just gonna leave it up to you guys today.
All right, cool.
So I did put on the Google Drive, I put it in the chat last time. It might even still, no, it's not there, but I can put it in again. But I put a checklist of kind of structures that you're like, Dr. Moore hasn't given you guys a checklist, it sounds like, but like, again, like Matthew said, anatomy is anatomy. So these are structures you definitely want to make sure that you can find. So I put them in the Google Drive for us, and I will put, if you don't know how to get to that, I will put it here in the chat. But I think that that's a good resource as far as studying for your lab exams. I know that helped me immensely. I would go through, and if I could find, if I like knew by just looking at the list, like, okay, I already know like where to find this, I would check it off. And then if there were structures that I was like, hey, I'm not really sure where this is, I would highlight it for like after doing my initial run through of like, I know where this is, and then go back and try to look at, like, go through Ackland's or whatever it is that you need to go through to try and find where that structure is. And then the other thing I put up too is also a muscle chart. So it has the muscle, the innervation, and the action. So you want to for sure make sure you know those things too.
At least the like insertion.
Yeah,
But
insertion origins are on there too. So that's a huge one. You want to make sure you're going to know those things. So the chart is up there, and so are the checklists. Or I guess with that being said, if you guys want to take a look at the checklist and see if there's, we can start with structures and then we can go into the lecture thing. Do you guys feel like you need some more help with some of the lab structures? Like, is there stuff, maybe, like I said, take a look at that checklist and let us know if there's something you need help identifying. But we have a place we can start.
is that kind of how he does it? Like, does he, I mean, I know he doesn't give you a list, but is it kind of seem like he's just going through a list and like pointing out certain structures and then saying this is this and then going on from there? Is that like how his lab's set up? I think you're muted if you're trying to talk to us.
Yeah, the
Yeah,
first
there's
quiz
anything
was
else.
just like identification from like Ackland pictures and then some other like grand dissector pictures. But I think, and you guys can correct me if I'm wrong, it sounded like we could also potentially get some questions as far as like it's identifying it, but saying like, okay, what does this muscle do? Or
Yeah.
like what nerve innervates this muscle or whatever.
Yeah, you'll
Yeah, that's
definitely get questions like that.
pretty much how ours was, yeah.
Yeah.
Like it'll
I
point
think
out a
it's
muscle, you have to know it, and then have a secondary question from that.
So we can do that where we go through structures, or another thing too is we have like a little, basically like a little review that has like questions we can ask you and see if you guys can get the right answers from those questions, and whether you are right or wrong, we can also go through why that answer is correct. That makes sense. So it's up to you guys what you want to do with this tutor session. I know it's before your exam, so whatever you feel like is going to be more helpful, if you guys want to go through some of those things on that list that are structures, or if you want to go through the review, we have both of those options available. Let us know.
I also don't have any question at the moment, but I will look at that checklist. So the checklist on the folder under tutoring, right?
Yeah, so
Okay.
it's also, the link is also in the chat too, that'll
Oh,
take
okay.
you
So
to
that's
the Google
like the
Drive.
back checklist 2019, and there's like a few of them that you uploaded. The axilla.
Yes.
Okay,
So there's arm and forearm, axilla, brachial plexus, arm, and then the back.
great.
And I I think that should cover, according to your syllabus, that's what you guys have gone over so far, correct? Is back and arm, pretty much. Arm and
And there,
hands.
there, there may be some that are a little bit different because ours isn't lined up perfectly with yours, but for the most part. And you should realize if you have never seen it, then there's a good chance that it's probably not in yours. But do y'all want to just
He
go through that review
flew
then?
through he flew through a lot of the hand information that's going to be on the test, so maybe like going through that would be helpful.
Sure.
Yeah, so the hand is very complicated, so I don't know why he would fly through that information. Like in PT, there's specialists particularly for the hand. That's how minuscule and just complicated the hand gets. So I don't know. I don't know why he would go through that very fast, but we can definitely go over the hand.
Aaron and
He
Matthew.
he went through it, I think, because like it was on our syllabus, and he was like, "Oh, we have to get through all this today." So he kept like skipping through the videos of the Grants dissector, and he was just like, I don't know, he like fast forwarded towards like the end, and he was like, "All right, like we're finished with this one. Like I have two more I need to go over and stuff like that." So I like missed a lot of the hand stuff too, and like some of the forearm even.
So like pinpointing what is what basically, or like lecture material in
Yeah.
the hand.
He was just sliding through the videos
Like
and being
key
like,
points that we should know.
here's the
Yeah,
arch,
basically
zoom.
Berkeley
Here's
saying.
this, zoom. Here's
Right.
this. And we were
Exactly
like,
what he
what?
All right, I'm also putting up, I realized I don't have the hand and wrist checklist, so I'm adding that right now, and then we can go over that. So give me just a moment. Aaron or Matthew, do one of you guys, I mean, I can too, but do one of you guys have, never mind, I got it. Let's see. This. Just trying to download this for you guys so that you guys can have access to it and follow along with
So
me.
kind of big points with the hand and forearm stuff. I would definitely know like kind of nerve innervations, like if like one was out, then what kind of like nerve palsy would you get? So like on your third PowerPoint, I think like the fifth slide, it kind of shows like a median nerve palsy. Um, so I would definitely know that one, especially if you put it on his PowerPoint. And that's kind of just knowing like which muscles are innervated by which nerve, and you can kind of figure out what exact nerve palsy will happen. One thing to know. Y'all know the like thumb positions, because they're pretty confusing sometimes.
Yeah, like what is it, like abduction and then extensions kind of confusing sometimes.
Yeah, so abduction is like
Mhm.
just straight out. I don't know if you can
Okay.
tell.
Mhm.
And then flexion is straight across, so like you're holding it against your palm. Opposition is kind of straightforward, just pinky to pinky to thumb. And extension is straight out like this.
Okay.
And you may learn different ones later on. We've learned like 3 different types, but that's just something.
To add on to that, I would just make sure to know that. So usually flexion and extension is usually in the sagittal plane, but in the case of the thumb, flexion and extension frontal plane, if that makes any sense.
Because of anatomical position.
And anatomical positions.
Okay, the wrist checklist is up.
Aaron, I can just read off our list that we made last
Yeah,
time.
yeah,
There's
that
a lot
works.
of like forearm and thumb stuff or hand stuff on here.
Yeah, that's probably better.
So, okay, I'll just read off the list that we made of important stuff. If anything comes to mind of anything you'd like some clarification on, we can do that. So first thing I have is upper extremity dermatomes. So definitely know those. You should know what the annular ligament does. And then subluxation or dislocation of the radial head, brachial plexus injuries. I believe we went over brachial plexus injuries last tutoring session, so know those. We also went over upper extremity compartments last tutoring session as well, so know those elevations. Do you guys know your forearm muscles? Did he teach you pass, fail, pass, fail? Did he teach you that?
No.
He didn't?
No.
Okay.
Nope.
Heck no.
Nope.
All right, let's see if I can. You say pass, fail to remember the forearm muscles on your anterior side. So it'll be pronator teres, flexor carpi radialis, palmaris longus, and then flexor carpi ulnaris.
That's on your slide 40 of the second PowerPoint. And it'll kind of show you a little bit more like what we mean by pass fail, pass fail. And you can use your fingers to even help.
Yeah, I usually go like, I don't know if you guys can see me because my computer's being done, but I usually go like this, and you can do pass, fail,
Yeah.
to know where the attachments are. I'm going to try and pull up. Aaron, are you able to share your screen of that PowerPoint slide so
Yeah.
we can show them the actual diagram? I think that would
Yeah.
be helpful. It's just in order to remember the area, especially if you're looking at like an anatomical, like a picture that's of a cadaver versus an actual diagram too. Sometimes it's a little hard to know what is what, but this kind of helps you to be able to know the order that those attachments are in.
So
So that's what
pronator
he's
would
talking
be,
about.
yeah, like pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. And that's just the
So
pass fail, pass fail.
what exactly is that showing us? Like muscles that affect the forearm?
So
That's
it's
just,
muscles of the forearm.
yeah.
In fact, Aaron, is there another picture on the slide that shows like an actual diagram, like what you have over there on the right? Yeah. That should be.
Yeah, right there. So it just kind of shows like muscle attachment and kind of the direction that it's going.
So all of the flexors of the wrist are going to be attached onto the epicondyle there, the lateral, or not lateral, sorry, medial epicondyle of your humerus, or not, yeah, your humerus. So that's where all of the flexors attach, is that medial epicondyle. But this is just so that you know the order of where they are going. How are you guys with identifying the carpals? Like which one is which?
I'm getting better. I actually watched a YouTube video and learned like mnemonic kind of.
Okay, yeah,
It was like starting at the thumb on the bottom and going clockwise.
uh-huh.
It's like so long to pinky, and then I forgot
Yeah.
what was the second part?
So long to pinky, here comes the thumb.
Yeah.
Aaron, would you mind, since you're already sharing your screen, would you mind going to a picture of the carpals for me? So here's a good way as far as identifying the carpals that's helpful to me. I actually learned this in undergrad anatomy, and it was really helpful. Pulling it up there on the side. Okay, the way this one is numbered is a little bit weird, but if you start on the side here, where is it?
It's 1. Starts at 1.
Yeah, okay. So here we have the scaphoid at 1, right? So if you start at the scaphoid is going to be on your thumb side. So if we start with our scaphoid, the next one over is going to be lunate, long. And then the next one is your triangular or triquetrum, which is 2. And then the pisiform is right on top of the triquetrum and that's pinky in our mnemonic. And then here is going to be your hamate is going to be on the same side as your pinky. So in this case, we're coming up. It's that number 8. So that's our here. The C is going to be that capitate for come in our mnemonic, and then the is trapezoid, and then the furthest one that's out right there, number 5, is going to be the trapezium. And the way I remember, sometimes it can be confusing because there's 2 T's, whether it's the trapezium versus the trapezoid. I remember the trapezium is going to be at it's the last one versus the trapezoid.
And it kind of sounds like thumb at the end.
Yeah.
Yeah,
That's what I
exactly.
remember.
It sounds like thumb, which helps. All right, so those are your carpal bones if you need help to remember those. I think going back up to the metacarpals, just some important as far as attachments. And Aaron, if you can be my screen helper here, but we're going to be talking about like the abductor pollicis, for example. So the abductor pollicis longus, that muscle attaches to the base of your first metacarpal, which makes sense because it's going to help with the abduction of your thumb. So it attaches, so abductor pollicis longus attaches to the base of the first metacarpal. And then we're just going to go through the metacarpals and what attaches to them. I guess I have that highlighted as important here. So extensor carpi radialis longus is what's going to attach to the base of the second. I think he's still looking for.
This is being recorded, right?
Yes, it's recorded.
You said extensor. What was it?
Extensor carpi radialis longus. So extensor carpi radialis longus attaches to your the base of your second metacarpal. And then, which again makes sense because think about it's called it's the carpi radialis longus, so it's going to be longer and it's attaching over towards the thumb side, which is where your radius is, right? So extensor carpi radialis longus attaches to the second base of the second metacarpal, and then your extensor carpi radialis brevis attaches to the base of the third metacarpal. Now, the second and third metacarpals also have an attachment for your flexor carpi radialis. So flexor carpi radialis attaches to the second and third metacarpals as well. And then we don't really have anything for the fourth metacarpal. So we're skipping the fourth and then we're going over to the fifth. And the fifth has extensor carpi ulnaris attaches to the base of the fifth. Again, think about where you are in the hand. If you're on your more medial side, so the side of your pinky, that's where your ulna is, right? So it makes sense that the base of the fifth is going to have extensor carpi ulnaris attached to it. And then flexor carpi ulnaris also attaches to the base of the fifth metacarpal. So those are some important things to know as far as attachments. So again, anatomy is one of those things where if you try and think through, logic it through where it might attach, what its function is, it'll kind of help coach you as to where the attachment might be.
You said flexor carpi ulnaris attaches to the fifth as well?
Yes. Okay. Anything else you guys want to add? If not, I'll keep reading through my notes of what's important. Aaron, Matthew.
I can keep going down the list if you like.
I got the.
So next I had, do you guys know your pad versus dab muscles in your hand? Yes, no, maybe.
He mentioned it, but I
You
forgot.
said it, but it was so fast.
Okay,
We got
so
you.
So your pad, PAD, and your dab, DAB. So your pad is your palmar interossei. So PAD, AD standing for adduction. Palmar interossei does adduction. And then your dab, that's your dorsal interossei, and that does your abduction or abduction. That's just a good way to memorize the function of those. All right.
Can you repeat the P and the
Yeah.
A again, please? I lost you.
Yeah, no, you're good. So PAD, PAD. So the P stands for palmar interossei, and the AD stands for adduction or adduction. Good?
Yeah,
Right.
thank you.
No problem. Okay, next I have your deep and superficial palmar arch. Then do you guys know the function of your lumbricals? Yes, no? I don't know. Well, anyway, so your lumbricals, we call them your bye-bye muscles because they do this motion right here. So it's extension of your IP joints and then flexion of your MCP. That's your bye-bye muscles. So I have Tommy John procedure. We did carpal bones. Do you guys know about your anatomical snuff box?
Mm-hmm. There's
Yes.
so many questions on Preppy about that with the scaphoid and stuff.
All right.
Okay,
So
so
you guys are good.
what makes up your anatomical snuff box?
All I know is something about the scaphoids.
Okay, let's go over that then.
So you can palpate, yeah, you can palpate your scaphoid within the anatomical snuff box. But I would say the important things in there are your extensor pollicis longus tendon, your extensor pollicis brevis tendon, your abductor longus tendon, and you can also palpate the radial artery within your snuff box. I don't know if Aaron has a picture when that'd be better. So we call it a brevis sandwich because your extensor pollicis brevis is going to be found in between your abductor longus or your abductor pollicis longus and your extensor pollicis longus. Yeah, I don't know if Aaron has a picture.
Yeah. He mentioned the radial artery, that area. So your extensor pollicis longus, brevis, and adductor pollicis longus, that's innervated by the radial nerve. Again, like the easy way to remember what is innervated, your extensors are going to be innervated by your by the radial nerve. Because remember where the radial nerve passes. Yeah, there's a nice picture of it.
So it's, Matthew, you said extensor pollicis longus, and the brevis is in the middle, and then what was the last one?
Abductor pollicis longus. And if you can palpate these on yourself. I mean, eventually you're gonna have to learn how to palpate these anyway, but at least during the test, I like to go stretch out my thumb like this and get my anatomical snuff box out. And you can easily palpate some of those tendons within there.
And like we said, if you think about it as a brevis sandwich, so the longuses are on either side of the brevis, that helped me too. So extensor pollicis longus, extensor pollicis brevis, and then adductor pollicis longus. And again, think about where they are. The adductor pollicis longus is going to be the one that's most, I guess you could say, lateral, like on the most outside towards the thumb.
All right, so next on the list, are you guys familiar with how the interosseous membrane works? On your, yes, no. So this
No.
If we
No.
need to.
So let's see if I can find my picture and maybe share it, but there's a
You're talking
certain,
about interosseous membrane between like the radius and the ulna, yeah?
yeah, and how force is distributed in between there.
Yeah, I think there's a good picture on our slides. I'm not as familiar with theirs, but I can try to find what slide it's on. It might be. Did you find it?
I have my slides, so I can share my screen maybe.
I was gonna say it might be in the forearm slides versus hand and wrist.
Yeah. I'm gonna take over your screen, Aaron. So sorry.
Yeah, you're good. You're good.
Okay. Can you guys see my screen? Okay.
Yeah.
Okay. So when a force is applied, like on your arm, majority of the force is gonna travel up your wrist on the radial side, and so it travels up. If you follow this arrow, it travels up the radius, through the interosseous membrane, and then back up through the ulna here. That's how force is kind of distributed when you fall on like an outstretched arm. So that interosseous membrane really distributes that force throughout the arm instead of just putting it all on the radius. Okay. So that ends up being more of a kinese kind of concept, but this is on my anatomy slide, so I assume is still applies here. What else did I got? Okay, so I have. Are you guys familiar with the compartments of the extensor retinaculum? You should be able to.
You mentioned that there is like a top and bottom to it, like superficial and.
Did he specifically go over like what muscle tendons travel through which compartment?
No, I basically did that on my own yesterday on YouTube.
Because
Well,
I think I saw it in his objectives. I might be wrong. I might have saw it in his objectives or whatever, but you should know what
So
is
I
in
got-
each compartment of the extensor retinaculum.
So there's the. Uh, so there's a tendon of palmaris longus. That goes through.
Do you have a diagram, Matthew, or do you want me to pull one up?
I'm trying to find one. If you have one, you can pull it up.
Yeah, I got mine up too.
You have it, Aaron?
Yeah.
You want to share it?
Yeah. It's not the best, but
Yeah, this is their PowerPoint, right?
yeah, but ours is right here too, so.
Yeah. We have one. We have a good one in ours too, but it's actually I like your guys' picture better because it's
Yeah, I
colored.
do too. It's color coordinated.
Ours, if you look at that ugly one right there, that's the one we had. So yours is actually better. So I would just know like which tendons and muscles go through each one. It's more just a memorizing kind of thing. Like he could just easily be like, okay, there's a knife wound at the fourth extensor retinaculum compartment. What is not affected or what function's not infected? So that could be an easy question he can ask as long as you guys memorize what's in each compartment.
Yeah. One thing that Dr. Moore did share with us is like one of the really best ways to study for his exams is like really make sure you know the stuff that's on his objectives list.
Yeah, and that applies for probably all your classes. That's a good suggestion to always look at your objectives list. I know I'm not always the best at doing that, but that's really straight up where you're gonna get your questions from. I think it's just a teaching standard, and so if you really study the objective list, you could and try to figure out some questions they can make out of that. I think that'd probably be a good way to study.
How much more do we have on that list, Matthew? I don't know.
I just got a few more.
Okay.
So as far as the carpal tunnel, it's located in the flexor retinaculum and holds your median nerve. So when you get carpal tunnel, it's damage to your median nerve. I think I looked at your PowerPoint. I don't know if he talks about that much, but the flexor retinaculum has the carpal tunnel and holds your median nerve.
And then Guyon's canal is where your ulnar nerve is going to be passing through.
And then,
They like to ask questions on those kinds of things.
Yeah, we had a prep you question on that.
okay, and then we just have arteries and nerves of the forearm would be my last thing. So that's our list.
Just, just arteries and nerves. Not a big deal. You say that like so nonchalantly. Speaking of which.
Did you
We
guys have
went
any?
kind of.
Okay, go ahead.
Oh, I was just gonna say we kind of went over some of the nerve like impairments in last one when you were talking about brachial plexus. Okay. Do you guys, with that being said, the list that Matthew just shared, the stuff that we didn't go over with you, is there still stuff you guys want like more explanation with, or do you think it would be helpful to have some like example type questions, like review questions?
Trying to think of some other topics.
You said you want some other topics?
I was just looking at the list because I know
Oh.
I had there was a couple more things that I was having trouble with.
I'm like searching through my notes too as far
Yeah.
as things that might be helpful for you guys.
And yeah, I believe that she uploaded the PowerPoints to that Dropbox or whatever it is.
Yeah, I have all of the PowerPoints we had for our class for these topics, as well as that like muscle chart list that gives you the action, innervation, blood supply, and attachments.
Yeah, that's actually one thing he gave us too.
I wasn't sure if you guys had that or not, so it's definitely helpful. Yes, the PowerPoint someone asked. Yes, those PowerPoints are uploaded to the tutoring files. That drive that I have right there, or that link, is where you can find those PowerPoints. To answer your question, Lindsay. No problem.
Do y'all just want to go through the checklist or something then?
That, or we can go through the questions and kind of like think through, because I think that's important to.
Yeah. Would y'all rather have extra questions or go through the checklist?
I mean, we can have questions.
All right.
I don't know how well we'll do, but we'll work them out.
It's okay. That's why we're here.
Yeah.
Do you have them on yours?
Yeah, I have it on mine. Let's see.
All right.
Okay,
I'll let you take over.
sounds good. This should be one, we didn't directly talk about this, but should be helpful. Okay, I will give you, it'll be multiple choice. I'll give you multiple things to choose from, all right? So in anatomical position, the pronator quadratus is located where? So A is anterior to the flexor retinaculum, which we kind of talked about just a little bit. Lateral to the brachioradialis. Posterior to the flexor digitorum superficialis. Or medial to the brachial plexus. Again, in anatomical position, the pronator quadratus is located A, anterior to the flexor retinaculum, B, lateral to the brachioradialis, C, posterior to the flexor digitorum superficialis, or D, medial to the brachial plexus. And if you feel like you know the answer, go ahead and come on and say it. And Matthew or Aaron, if you guys want to try to pull up a picture of that, because sometimes my computer doesn't like me to share
Yeah, I'm
Doesn't
trying
the
to find it.
hand always stay medial in the anatomical position?
That is incorrect, but it's okay. We will explain why. But anybody else want to take a crack at it? So now you have three choices to choose from. So again, we're talking about the pronator quadratus. So try to think about in your mind where pronator quadratus might be. Is it anterior to the flexor retinaculum? Is it lateral to the brachioradialis? Or is it posterior to the flexor digitorum superficialis? Again, this is like a lecture question, but it does tie into lab too, so you might have questions like that. So I'll give you a few more seconds while I'm still looking for a picture to show you. I might even just use good old Google.
Oh, he found it. He's giving the next question.
Huh? Did you find it? Did someone find it?
Oh no, he just put the question.
Oh, okay. I'm trying to show the actual like picture. Trying to find a good picture to show though. Work.
Oh, I got this question wrong when I was taking it.
Okay, here. This is actually not a bad picture. If I can.
Yeah, just
It's
take it
from
over.
Le Google. So
Which one was the incorrect answer for number one?
it wasn't
B.
medial. Okay,
I
here.
feel
I'm
like,
just
Okay.
gonna
I feel
show
like
you
it's B,
guys.
but I feel like it's B,
I
but I
was
really
gonna say
don't
probably B lateral to the brachioradial.
It's not, but it's okay. I'm just gonna show you.
That's
Alright, I
Here we
tried.
go. All right.
Gosh.
So we're talking about the pronator quadratus, right? So the pronator quadratus is its attachments are both on basically that lateral border of the radius and then the medial, or then also the lateral border of the ulna. So it's what helps pronate your wrist. It helps you to be able to do this motion, right? So if we look at the question, or the question was asking what position it was in, right? So really we can eliminate the game of taking like the name of the game and taking a test for anatomy or any test really for any of your professors is try to think about, okay, play process of an elimination. What can I eliminate from the questions? So we already know it's found right, like I said, on the between the radius and the ulna, but it's kind of a midline structure, right? There's not really anything, if you look at it, that's medial or lateral to it. So when we're looking at our question bank, we can pretty much eliminate anything that says medial or lateral, except for now, if I share my screen, you're going to see the answers. So, Aaron,
Matt.
Aaron or Matthew, can you read the question again?
Just
The first question?
Yeah.
Okay, give me 1 second. It says, in anatomical position, the pronator quadratus is located anterior to the flexor retinaculum, lateral to the brachioradialis, posterior to the flexor digitorum superficialis, or medial to the brachial plexus.
Okay. So yeah. So see, here is the flexor retinaculum. So, sorry, you repeat the question again, Matthew?
In
Just one more
anatomical
time.
position, the pronator quadratus is located anterior to the flexor retinaculum.
Okay, stop there for a second. Okay, so your flexor retinaculum is right here where my arrow is, right? There's nothing that's anterior to the flexor retinaculum, so we can cross that one off. Okay, next one.
Lateral to the brachioradialis.
Okay, so your brachioradialis is right here. No. Brachioradialis is, it should be this tendon.
Yeah, it's not on there.
Yeah, it would be this tendon right here, though. So it's not lateral, though, right? Again, we said this is a midline structure, so it's going to be medial, if anything. So we know it's not lateral, so we can cross that off. Next one.
Posterior to the flexor digitorum superficialis.
Okay, so your flexor digitorum superficialis is right here. Okay, and we know that this structure, like if you were able to see it in lab, which I know you guys don't have a cadaver, but when we were in lab, you could literally take all of your flexor tendons, pull them to the side, and there was this very flat muscle, and it's in the very back of everything. There's nothing further to go. That's where your pronator quadratus is, and it looks. I'm trying to see. Let me go back. There's a better picture of what it looks like just like this without everything in the way. It's this right here. Again, I'm just taking this off of Google to show you, but and my computer is taking forever. But yeah, it's just going to be that flat muscle that comes right across there. And then what was the last question, Matthew?
Is medial to.
There.
Oh, sorry, I'm muted. Medial to the brachial plexus.
Okay, and then the brachial plexus, I don't think it shows on here.
That's not even.
But yeah, the brachial plexus is coming out way up here in your arm, so you know that's not going to be one. So was that helpful at all going through that exercise of like how to kind of eliminate the questions? We can go through some. Do you guys want to continue going through questions? Was that helpful?
Yeah, so there was
No.
Yes. Okay. Aaron or Matthew, do you guys want to lead out? I don't need to.
I don't
fully over.
have the
If
questions.
not, I can.
We can do the second one. This is a good question.
Wait, what was the answer for number 1?
It's posterior to the flexor digitorum superficialis. Again, like I said, we can pretty much take out the medial and laterals because it's a central structure. We know that the flexor digitorum, or the flexor, or I can't speak, the flexor retinaculum is going to be one of the structures that's most anterior. There's going to be nothing anterior to it. So the logical answer left then is posterior to the flexor digitorum superficialis. So C. Sorry, go ahead, Matthew.
Do you mean down share your screen? Matt.
He's gone.
All right. Well, let's see if I can find the questions. Tanya, you just want to read it?
I just don't have I'd have to like zoom in so that they
No,
can't.
I'm here. Sorry, I was.
Okay. I was like, he died.
All right, can you see that okay, guys? Oh, no, that's not what I want. That's for me. All right, so number 2 here. That. So a 41-year-old male has a lesion of the upper trunk of his brachial plexus. Herb Duchenne paralysis causing waiters to morality. Which of the following is most likely the deficit? This is an excellent question.
We went over this in tutoring too. So
Yeah,
you guys should know this. I have faith in you.
The one with medial rotation.
Yeah. Everyone get that? Yes, no, maybe. Cool.
Mhm.
Yep. So yeah, we went over that.
Just to go over Herb's or Waiter's palsy again. Are you guys good?
Good? All right. We'll go to the next one. So 21-year-old patient had his thoracochromian trunk ligated. Which of the following arterial branches would maintain normal blood flow? Do we know?
Any best guesses?
Nope.
All right.
Find a picture.
Yeah, go find a picture. So the answer is, honestly, I don't know the answer, so I'm double checking. But yeah, superior thoracic is the right answer. We were debating over here what the answer was. But superior thoracic is the answer. Yeah, so if Aaron can find a picture of that.
trying to find a good picture too of just blood flow, but like one that's well labeled too.
And there are some other practice questions in the bottom of some of our PowerPoints, just as another tool to look at more questions. Or in the middle, I guess, at the bottom.
The answer was, where'd it go? Superior thoracic. I'm trying to find the superior.
Yeah, I can't find a picture of it. I don't know, y'all just want to go to the next question?
Yeah, I can keep looking for it if you want to go to the next one.
Yeah, I'll pull it then. Question back. Okay, so a 39-year-old cannot raise his arm above horizontal and exhibits a condition known as wing scapula. Which of the following structures of the brachial plexus is most likely damaged?
Is it roots?
Yes, I believe it's roots. Gosh, why can't I erase this? Let's see.
Why would it be roots?
Yeah, there you
Because of
go.
the long thoracic, right?
Comes off
Yes,
of,
because the long thoracic nerve. Where does the long thoracic nerve come off of?
C5, 6, 7.
Right,
It is
5, 6, 7. It comes off of those roots. So it makes sense that if you have an injury to the roots, then it would affect it because it comes off of roots of C5, C6, C7. Good job, guys.
Let's see.
I'm trying to find a picture of the I found a picture, but I'm trying to find one in the slides to give a good reference.
Some of these questions won't apply to your section, so I'm trying to find a good one for you guys. All right, this one might be a good question. So a 22-year-old female fell from a motorcycle, fracturing her humerus. Imaging showed a spiral fracture at the mid-shaft of her humerus. The radial nerve was severely injured as a result of the fracture. Which of the following conditions would most likely result from this accident?
Wrist drop.
yes.
Yeah. Yeah.
Because basically anything in the,
Yeah.
I just remember from radial, it kind of happens to be wrist drop, right?
Yeah.
Yeah.
That's all
Yeah,
extension.
and yeah, like I said, if you remember about like radial nerve is in charge of extension, that can help you to be able to eliminate some of the others. I have a picture.
Yeah, go ahead and share so I can erase more of these answers.
Okay. It's not like the best picture ever, but can you scroll back? Oh, never mind. It's okay. Can you read the question that was attached to that this picture?
The question?
Yeah.
Okay, a 22-year-old female fell from a motorcycle,
I think that.
fracturing
No,
her humerus.
not that question. The
Which
one
one?
about arteries.
Yeah.
Here you go. A 21-year-old patient had his thoracoacromial trunk ligated. Which of the following arterial branches would maintain normal blood flow?
Okay, what are those? Sorry, go ahead.
Acromial, pectoral, deltoid, or superior thoracic?
Okay, so here's the thoracoacromial trunk right here. So if this was ligated, if something happened to this right here, the supreme thoracic artery or the superior thoracic artery is way up here. It doesn't have a branch that comes off of the thoracoacromial artery. This you can't see. It doesn't have it. I didn't pick the best slide. Here we go. This should be better. What were the other choices again, Matthew?
I think it was like acromial, deltoid,
Okay.
clavicular, and pectoral, I
Yeah.
believe.
Yeah, they come off of here, but this slide doesn't show you them. I'm trying to find a better one too. But basically, those other arteries, if I'm trying to find from your PowerPoints, this is in our PowerPoints, but the acromion and the deltoid, they come off of the thoracoacromial trunk. So it makes sense that if it was ligated at the trunk, then those arteries that come off of it are going to be affected. Whereas the supreme or superior thoracic artery doesn't have a branch that comes off of the thoracoacromial trunk. So hopefully helps a little bit. Also, if you think about like as far as trying to remember what arteries come off of where, supreme or superior thoracic will come off first before your thoracoacromial. Just think about it as superior, it comes off first. Hopefully that helps a little bit. There was a better picture, I think. Anyway, in any case, hopefully that helps with that question a little bit. Continue, sorry.
Did we send them that review?
No, we did not. But I can put them up.
Yeah.
The only problem is that it like tells you the answer right away.
Yeah. Oh shoot, I gotta erase this answer before I show you. All right. This will probably be our last question. And all right. And we did go over the cubital fossa last tutoring session. So a 44-year-old presents for therapy after suffering a stab wound in the most medial side of the proximal portion of the cubital fossa. Which of the following structures would most likely be damaged?
Brachial?
No.
I was gonna say median.
Yeah, I mean, watch, it's gonna be like,
Yeah, no. It's the median nerve.
it is, okay.
Yeah, it is.
Again, think about your anatomy, right? So we talked about if we're talking about the back of your arm, what nerve would it be? If we're talking about the back portion of your arm, what innervates that? I know you guys know this, but the posterior part of your arm is innervated by what nerve? Think about the brachial plexus. What are the what extends your wrist? What nerve innervates your extensors? I just went over this. I know you guys know this.
You just answered it right a second ago.
Yeah, it was one of the other questions.
Radial?
Yes.
Yeah.
It's your radial nerve, right? So radial nerve comes off and it innervates all of your extensors. Just think of the posterior, any question that's asking about a muscle for the posterior part of your arm, that's going to be radial. If we're talking about the upper portion of your arm, we're looking at I can't speak. You cannot say it.
Musculocutaneous.
Yes, that's what I'm trying to say. Okay, so we're talking about your biceps, your brachialis. That's going to be musculocutaneous. Then I still can't speak, but it's okay. It's fine. When we're talking about the flexors of your forearm, right? Then we're going to think median. So try to keep that in mind. If we're talking posterior part of the arm, any muscles of the posterior, those are going to be radial. When we're talking about the your actual arm, not your forearm, but your arm, that's musculocutaneous. I said it right this time. And then when we're talking about your flexors, then of the forearm, those are going to be median. So this makes sense when we're talking about like that cubital fossa. And here we talked about the cubital fossa, that's going to be median. It might be a little bit like tricky if maybe they put like musculocutaneous because it's kind of in that area, but they don't even give you that as an option. So radial nerve we can cross off for sure because we know that it's not in that area at all. Same with the artery. So hopefully that helps a little bit. All right, guys. Well, good luck on your exam coming up. Again, if you guys need any tutoring help before now and your exam, feel free to reach out to Aaron, Matthew, or myself.
Did you guys say you were gonna upload those questions or to the drive?
I can.
And do y'all also have all y'all PowerPoints on there too?
They're all there.
So yeah.
All right. And then
Okay.
another question: if we do need like some quick assistance from one of y'all three, do we just call you guys and have like a one-on-one session?
Yeah, so if you need a one-on-one session, you can either email us or text us. I'll put my
Or if it's a quick question, you can just ask through the text. It's not gonna. We don't need a whole session for one question.
True. If it's
If
like
that
a
makes
quick
sense.
question, feel free to just shoot us, a text or whatever. If you actually need help with something, you want to talk it out or whatever, then we can set
And it
up.
doesn't just have to be a one-on-one session. Like we can do small groups as well if you're not comfortable just being by like just us. But yeah, so we can do any of that for you.
And it's not letting me type in here. My computer is wigging out. But you should be able to just type our names into your HU. Here, I think it's finally letting me do it. That's my email. And there's my phone number. So yeah, if you guys need assistance, you can contact me, Aaron, or Matthew for help.
All right, thank you. So for the most part, is anatomy the most difficult class that we'll take?
I'd say so.
I mean,
It's different for everybody, but like for me, it was definitely the hardest class.
Okay.
I feel like
I mean,
it
the
can
good thing is
be.
the first year we
Matthew's
did,
like,
and this
It's
the
your
only
first.
semester we taking it, right?
Not, I mean, it's the only semester you're taking it, yes, but it's definitely going to come back in all of your other classes. It's like the foundation from, if you don't know it now, like, it's
Mhm.
really going to hurt you later.
Well, I wouldn't say it's the hardest, but you kind of figure things out. So like your like studying habits and everything, you figure that out kind of as you go. So like you don't really know what you're doing very much the first time, like studying wise. So then after that, you kind of figure it out, and it gets easier because you figure out faster ways to do everything, if that makes sense.
I think also a nice thing for you guys, I mean, I don't envy your position because you're having to take it online, but the nice thing for you guys is you don't have to identify it in a cadaver, and that's very difficult, like to actually have the cadaver in front of you to do. And then also, you guys are taking neuro right now, which there will come a point in neuro that will overlap with what you're doing in anatomy, which will help you because it'll continue to, like, when you're going over anatomical structures in the brain, you're going to be going over them in anatomy too. We didn't take neuro until the second trimester. So that's to your advantage too. We had another difficult class we were taking at that time too. Not to say that neuro isn't difficult, but like I think that added to the stress for us of it. Like I said, I don't envy your position in being like having to take it online at all. But like keep your head up. This is your first trimester. You're still trying to get the hang of things of how to study and everything. So yes, it's going to be difficult. In fact, like I know that there were several people in our class who like did very poorly on some of the exams, but you dust yourself off, you get back up, and you learn you learn from your mistakes too. Like, okay, I should have studied this a little bit more. I should have taken like advantage of this. This is the area. You kind of get used to how the professor asks questions too. So it will continue. I can't necessarily say that like it gets easier from here, but you start getting the hang of it from here, if that makes sense.
It feels easier.
and we
The
also
classes
don't
aren't
have
necessarily
time.
easier.
And I don't want to be a downer to Tanya's pep talk, but next semester you guys should be taking kines, and for me that is the hardest class. But
Kines
if you
was harder.
have your anatomy down, that class will be easy for you. So
It will help, yeah.
it would definitely help. But Kanice is a monster. Dr. Pashun is wonderful. She makes board questions, but it's a lot of studying for sure.
Yeah, for sure. I mean, I felt like I knew my anatomy pretty well, and Kanice was still. I liked Kanice. It was a challenge for sure, even with knowing your anatomy well. Alrighty, guys. Well, have a good long weekend and happy studying to you.
Yeah, thank you guys.
No problem. See you later.
See you guys.
Yeah.
Thank you.
Thank you.